Let's now speak to Marcus Plescia. He joins us from Charlotte in North Carolina. He is the Chief Medical Officer at the Association of State and Territorial Health Officials. That's a group that represents public health agencies in all 50 U.S. states. Marcus, thank you for joining us at such a busy time. And I would like to start with timing. Most, if not all, medical experts are saying that we're going to see waves of infection for as long as we don't have a vaccine. Optimistically, that's potentially at least a year away. So how do you reconcile that with easing lockdowns, knowing that subsequent waves of infection are likely?
Well, the big challenge for everybody right now is this issue of needing to begin to reopen society, needing to begin to let our economy go back to work. And that's a very challenging situation to be in. There is a way forward, we believe, in public health. There's now very good guidance. The White House, together with the Centers for Disease Control, have put out guidance for states and communities to help them decide when the time is right for them to be able to open and the kind of things they need to do to be able to reopen their economies and their society successfully and really reduce the chances that there'll be a rebound in infections. The National Governors Association is about to come out with this very similar document. So there's some very good information and guidance now for states. And our suggestion is that they really look at that guidance and use that to help them making these difficult decisions.
Let me ask you more about that criteria, Marcus, because the administration's plan, I believe it's called Opening Up America Again, that includes same-day diagnostic testing for all patients with symptoms, as well as strong contact tracing. And these are the two main criteria, I believe. And testing has been a huge issue from the beginning. What's the capacity like now for both those interventions? And do you think it's enough to start reopening, enough to warrant that?
Well, testing has been a big challenge. It does seem like we're starting to have the manufacturing capacity to put the tests in place. We continue to have some problems with the reagents or ingredients for the test. The hope is that'll work itself out. And the hope is that within a few weeks, certainly by the summer, we're in a position where states can have good data to monitor what's going on with their cases and to know that the infection rates are trending in a downward direction. That's the time that it's safe to start thinking about reopening. That's the time that you can very carefully monitor your cases and also other surveillance systems that we have so the states can closely watch what's going on. It may be in some situations that states will reopen, start to normalize, and then they'll have an uptake in cases and they'll have to scale back. That's what we're expecting. We're calling it a pump the brakes type approach, and everybody needs to be prepared for the fact that this is going to be tough going for a while.
Sure. Well, surveillance also requires coordination, right? And we've seen plenty of tension between the White House and state governors, particularly Democratic ones. Also tension, too, between the various states as they all try to get hold of all the resources they need. You're someone who deals with coordination. What's the state of the relationship now between municipal, state and federal levels of government when it comes to pandemic response?
Well, the relationship at those three levels, municipal, state, and federal, I think is very strong. State public health departments, for the most part, take their guidance from the Centers for Disease Control. The Centers for Disease Control is, one of the authors of the recent guidance on how to reopen. The Centers for Disease Control provides a lot of the information we have about surveillance. States trust the Centers for Disease Control. I think that relationship is strong. I think if those pieces can stay together, we'll be in a good place to begin to move forward.
Marcus Plescia there, the Chief Medical Officer at the Association of State and Territorial Health Officials. Thank you so much, sir, for your time on Al Jazeera today.
Thank you for having me.